Okay, so here is my blank sheet. If I can get it open. It's a little dark in here. Okay.
Come in.
Hello, my name's Allison. I'm going to be your student nurse today. Can you tell me your name and date of birth, please?
Kelsey Diltz, April 6, 2000.
Okay, and do you know what you're having done today?
I'm getting a head-to-toe assessment.
Okay, and can you tell me what year it is?
It's 2020.
Okay, so I'm just going to start off by asking you some questions about your history. Have you had any past procedures that I should be aware of?
Nope.
What about any past diseases?
Nope.
No? Okay. Do you take any medication?
I do not.
Are you sexually active?
Yes.
Okay, and are you a smoker?
No.
Okay, and how would you say your diet is?
It's pretty balanced. I try not to eat any like junk food or anything.
Okay. All right, so I'm just gonna start off with some vitals. The patient is A&O times 3, and I would take her blood pressure first, but we don't have a blood pressure cuff. And I would also take her temperature, but we don't have one of those either. So I'm going to start off with taking the patient's pulse and respirations. Okay, so the patient's pulse was 68 and the patient's respirations were 14. So now I'm going to move to the head, and I'm just going to first inspect for symmetry, making sure that there's no abnormalities. And I'm going to assess the facial nerve by having her open and close her eyes and smile and frown and puff out your cheeks for me. Okay, good. So that nerve is intact, and then I'm going to assess the trigeminal nerve by palpating on both sides. That feels normal. And can you open and close your jaw for me? Okay. Now I'm going to assess the temporal mandibular joint. Can you open and close your jaw again? One more time. Okay, and I didn't hear any cracking or popping, so that seems normal. From there, I'm going to palpate the head and check for any lesions or abnormalities in the hair and in the scalp. That looks good. Okay, so now I'm going to move to the eyes. And the sclera looks white, and can you look up for me? And the conjunctiva looks pink, so that's good. And then with the eye assessments, I'm going to be assessing the abducens, trochlear, and oculomotor nerves. So I'm going to start with the 6 cardinal fields of gaze. Just look at my pen and follow it. Okay, There was no strain on the eyes or anything like that during it. So now I'm going to test the reactiveness to light. Just look straight ahead. Okay, both eyes constricted when the light was pointed on them. So now I'm going to have you look at a distant object and then look back at the pen. And look at an object. Okay, so the patient's eyes constricted when looking at the pen and dilated when she looked at the wall. So now I'm going to have you keep looking at the pen as I bring it closer to your face. Okay, the patient's eyes constricted when I brought them closer, so the eyes are okay, the eyes are good, so I'm going to move on to the ears. So first I'm going to check the pinna in the mastoid process. Do you have any pain there?
No.
And what about there?
Oh.
Okay, so I'm going to look in the tympanic membrane, pulling the pinna up and back, and I'm checking to see if it's white and pearly, which it is. And I'm going to check this one. Looks good. Okay, so now I'm going to assess the vestibulocochlear nerve by I'm gonna cover one ear and have you tell me the words that I whisper back, okay?
Apples and bananas. Grapes and pears.
Okay, so that nerve is intact as well. Okay, so now I'm gonna move on to assessing the nose. Are you okay?
Yeah.
Okay. Can you tip your head back for me? Well, first I'm gonna inspect the front. The nose looks aligned and there's no abnormalities or lesions. So will you tip your head back for me? So I'm just looking inside.
It would be boogers there.
It looks pink and normal. There's no deviations. So now I'm going to assess the olfactory nerve. Can you close your eyes for me? Okay, and tell me what you smell.
Cinnamon.
Correct. Okay. So now I'm going to inspect the lips and mouth, and her lips look pink. There's no abnormalities on those. Can you open your mouth for me? A little wider. So her tongue looks moist and pink. There's no spots or lesions, and her there's no signs of tooth decay. I'm gonna look at your uvula. Can you stick your tongue out and then say ah for me?
Ah.
Okay, and that was testing the glossopharyngeal nerve. And can you stick your tongue out for me and move it side to side? Okay, and that was testing the hypoglossal nerve. And then her speech isn't hoarse or anything like that, so the vagus nerve is also intact. Okay, so now I'm going to move on to your neck. Whoops. And I'm just trying to think real quick. Okay, so I'm looking at her neck to make sure that it's in midline and that the trachea is in line as well, and I'm going to palpate the trachea to make sure it's symmetrical. Okay, and also the thyroid gland, I'm going to palpate that and make sure it's not swollen. And that feels good, so I'm going to palpate the lymph nodes and check those. And make sure they're not, make sure they're squishy and not painful. Does that hurt at all? Okay, That's the occipital lobe. And then the post-auricular, does that hurt at all? And then the pre-auricular, does that hurt?
Oh.
And the submandibular, that one hurt? No? And then the submental, what about that one? Okay. Now I'm going to go down the cervical chain and just make sure that there's no swelling. Can you push your shoulders forward for me? Okay, and I'm just palpating the supraclavicular lymph node, and that one is normal as well. So now I'm going to have you push your shoulders up. Okay, that's good, and that's testing the spinal accessory nerve. And can you put your head back and forward, and then look left and right? Okay, that looks good. Okay, now I'm going to I'm gonna take a look at my sheet and see if I've missed anything so far. Okay.
Just cracked a bit.
Okay. 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 So while assessing the ears, I forgot to say that I would usually use an otoscope instead of my pen light. And then, can you cover one of your nostrils for me and breathe in and out? And then same with the other side. And there's no difficulties with that for you?
Nope.
Okay, so, and then before I move to the shoulders and arms, I'm just going to palpate the carotid arteries and auscultate them as well. Okay, so both of those are 2+ in bounding, and now I'm going to auscultate one at a time. Okay, and both of those sound good as well. So I'm going to move down to the shoulders and the arms, and first I'm going to inspect and see if there's any, or see if they're symmetrical just by looking at them, and it looks like they are. So I'm going to palpate, or first look and see if there's any abnormal moles or lesions on her skin. And that looks good. Any pain in your arms? Okay, so I'm gonna palpate down the shoulders, just noting symmetry. Everything looks good. Okay, and I'm going to assess her range of motion in her fingers. Does that hurt at all?
Nope.
Okay, what about that?
Nope.
Okay, can you squeeze my fingers for me? Okay, and then push up on my hands, and then push down. Okay, now I'm gonna check for any clubbing in the fingers and or signs of cyanosis. I think I might have already said that. I'm gonna assess her cap refill, and that came back right away, so that was good. Can you do a swimming motion for me? Is there any pain in your shoulders with that?
Nope.
Okay. I'm going to listen for symmetry with the radial pulses. That would be quiet. Okay. and the brachial pulses as well. So those are both 2+ in bounding. Okay, so I'm going to look at my sheet again before I move to the back, just really quick. Okay. Alright, so I'm gonna check your turgor and your clavicle before I move on. And there's no signs of dehydration or anything, so that's good. Okay, do you mind taking your shirt off for me? And you can go ahead and turn that way on the bed. Okay, your hands might be cold. Okay, so first I'm just inspecting for any abnormalities or something that's not symmetrical, and I'm going to assess for the barrel chest. Can you take a deep breath for me? Okay, and she's not barrel chested, so that's good. Now I'm just going to palpate her lungs and check for any, or percuss her lungs and check, or I'm going to palpate her spine and check for symmetry with that. Okay, so now I'm going to percuss her lungs and make sure those are good. Let me know if you have any pain. I'm gonna lift this up a little bit. Okay, so that sounds good. Now I'm going to auscultate, listening for any cracks or wheezes. Okay, and then just take deep breaths each time I move my stethoscope, and if you get tired or need a break, just let me know. Okay, deep breath. Doing okay? Yep. Okay. Pull this up. Sorry. Okay. So her lungs sound normal. I didn't hear any crackles or wheezes. It was all clear. Okay, so will you go ahead and lay on your back for me in supine position? Okay, so while doing this, I would usually put the bed up to 45 degrees and watch for any jugular vein distension, but since we can't do that with this bed, will you look to the wall for me? And that looks good, so you can look straight again. So I'm going to listen to heart sounds. With the diaphragm, I'm going to be listening for lub-dub, and then with the bell, I'm going to be listening for any bruits or extra heart sounds. So for the aortic valve, I'm going to be listening in the second intercostal space on the right. Okay. And then the second intercostal space on the left is going to be the pulmonic. Okay, both of those sound good. And then the third intercostal space is going to be Erb's point. Okay. Then I'm going to move down to the tricuspid valve in the fourth intercostal space. Okay, and then the last one is going to be the mitral valve in the fifth intercostal space on the left side. Can you pull your breast over for me? Okay. Okay, and I'm going to listen to the apical pulse for 1 minute. Okay, so the patient's apical pulse was 63. Are you doing okay? Okay. So, okay. Now I'm going to move to the abdominal assessment. So first I'm going to inspect for any lumps or abnormalities or growths that would be concerning. And, excuse me, I'm going to auscultate the abdomen, listening, starting in the right lower quadrant and working clockwise. And I'm listening for bowel sounds, and I would listen for at least 5 minutes or until I hear 30 bowel sounds. Okay, so there were bowel sounds present, but they weren't hyperactive. So now I'm going to listen to the arteries, starting with the aorta. And then moving to the renal arteries. Did your stomach growl?
Yeah, I think I'm hungry.
Okay, and then the iliac arteries. You have lots of vowel sounds. Okay, and then the femoral artery. Can you pull your shorts down just a little bit? Actually, I'm just gonna go through here. Okay, so I didn't hear any bruise with those arteries either. So now I'm going to percuss, starting in the right lower quadrant again, and feeling for, or let me know if you have any pain, okay? Okay, so those sounded good, and I'm going to start with light palpation, and let me know if you feel any pain with these, okay? And I'm going to feel for any masses or lumps. Any pain?
No.
Okay. Okay, and now I'm going to do deep palpation.
Did you feel my rhythm?
Yeah. Okay. Okay, so I didn't feel any abnormalities with that. Now I'm gonna have you sit back up on the edge of the bed, and I'm gonna assess your legs. I'm gonna take a look at my sheet and see where I'm at. Okay. Okay. So you can put your shirt back on. Okay, so first I'm just going to inspect her legs, looking for symmetry and checking hair growth distribution, making sure that's even. And it looks like there's no edema or swelling or anything out of the ordinary. So I'm just going to palpate down the legs, checking for any swelling or edema. Looks good. Okay, and I'm going to, so I'm going to test your reactiveness to feeling. Okay, so this is sharp and this is dull. So I'm either going to touch your foot, your calf, or above your knee. So just tell me where I touch and if it's sharp or dull, okay? Okay.
Calf, sharp. Foot, dull. Knee, dull. Calf, sharp. Foot, sharp.
Okay, good. Okay, so now I'm going to assess your popliteal and check for symmetry with those pulses. Can you, yeah, that works. Okay, those are both 2+ and bounding. I'm going to check your postpedal pulses. You want to scoot back a little bit? And yeah, there we go. So those are 2+ and bounding, and now I'm assessing the post-tibial. And those are 2+ and bounding as well. Okay. And do you want to let your feet dangle kind of? So I'm just assessing her reflexes, and usually I would have an instrument to do this, but I'm just going to use my hand. Okay. Okay. And now I'm going to auscultate the femoral artery and the popliteal. And I'm going to listen or feel for your femoral artery as well first. So that side is 2+ in bounding. Okay, and that one is 2+ in bounding as well. Okay. Thought someone came in. Okay, so I don't hear any bruise or abnormalities with those. And I'm going to do the popliteal. Oops. Okay, so those sound normal as well. Okay, so I'm going to have you put your shoes and socks on. Okay, and can you stand up for me? So I'm gonna check if there's any swaying. Can you put your hands at your side and feet shoulder width apart, and close your eyes for me? And I would check for a full minute. And since there's no swaying, okay, you can open your eyes now. And can you walk heel to toe for me? Okay, that's good. Okay, you can just have a seat on the bed right there. So I would give this patient a Braden scale of 23. She has a good diet. Muscle strength is good. No pain or any problems with the skin where there would be any breakdown. I think that's all. Let me just double check my sheet, make sure I didn't miss anything. Sorry, my family is very obnoxiously loud. Don't see anything. Okay. Okay, so I think I got it all. Alright, her gait and balance is also intact. Okay.